Okay. And I'm going to click start. I'm going to turn my own camera off. That's important. And I'm going to click start. If everybody's ready, give me a thumbs up. Thanks. Cool. All right.
I'm going to give it a couple of minutes for everyone to trickle in and then we'll get started. You can see that the number of attendees coming in is slowing down, so I think I will make a start. So hello and welcome to this Creative Manchester and Faculty of Biology, Medicine and Health webinar today on Music in Mind, the training of care home staff in improvised music making for people living with dementia. And this research project was made possible through funding from the National Institute for Health and Care Research School for Social Care Research. I'm Robin Dowlin, and I'm one of the postdocs who supported this research alongside my colleagues Henry McPherson, John Keedy, who are here today, and our wonderful co-investigators and PPIE group Open Doors, who we'll talk about later in this presentation. And this session is going to present findings from this project, and we really encourage you to pop any questions you have about the project, the research, or the research team in the Q&A box, so we can answer these at the end of the session. And the Creative Manchester team are popping some more information in the chat for you. So we're going to start with a couple of introductions. So just to start, a little bit about me. I've been working with Manchester Camerata in the context of their music and dementia work since 2015, when I began my PhD research, which examined different impacts of music in mind as a case study. And I've come to know and understand the programme and its impacts over the years. And I've worked with a range of fantastic colleagues using creative social research methods to really understand the programme and how it works. So I'm just going to hand over to John briefly, followed by Henry.
Thank you, Robin. Hello, everybody. My name's John Keedy. I'm Professor of Mental Health Nursing and Older People at the University of Manchester and have a joint appointment with Greater Manchester Trust as well. It's been my great pleasure and privilege to work alongside Manchester Camerata since 2012. And this project was part of a programme of projects that we've been involved with since the very beginning. It's especially innovative, and I've been blessed to work with some fantastic colleagues in this project, two of whom you'll hear from today. But we are speaking in the context of a wider project team, and I think that's important for us to say. I'm just going to hand over now to my colleague, Henry.
Thank you, John, and hello, everyone. Thank you so much for being here with us today. My name's Henry McPherson. I was one of the postdoctoral research associates on this National Institute for Health and Care Research funded study. I now work as a postdoc at Creative Manchester, and my background is in music and specifically in improvisation studies, how improvisation is applied within health, well-being and social contexts. Just to echo what Robin and John have said, it's been a real pleasure to work with our wider research team on this project, and I'm looking forward to sharing all the things that we've come to in this work today. It's very exciting.
Great. So if I can have the... Sorry, Henry.
No, that's what I was going to say. Could we just move through to the next couple of slides?
Thanks. So I'm going to take us through the next couple of slides, just to give you a bit of a background to the project. So we're going to be kind of looking at the kind of origins of Music in Mind and how it evolved into the training programme that we evaluated as part of this research. So we'll talk you through the background, the context and methods, as well as the key findings from the study. And we're also going to really present and highlight the contributions to the project by Open Doors Research Group as well. So if we have the next slide, please. So to begin, we wanted to give an overview of what Music in Mind is and how this has led to the training programme that was the kind of the thing that we were exploring as part of this research. So Music in Mind is a programme that's delivered by Manchester Camerata, and it's focused on face-to-face improvisation-based music making with people living with dementia, with their family members, and also with staff carers as well. And it's been delivered by Manchester Camerata, who are an orchestra and charity in Manchester since around 2012. And it's a very interesting model because it brings together freelance professional orchestral musicians who are part of Manchester Camerata's orchestra with music therapists to work alongside people with dementia to co-create different musical improvisations in a group context. And over the years, it's been delivered in a range of contexts, including care homes, community settings, and for a brief period of time in hospital wards as well. And since I've been working and kind of exploring the Music in Mind programme, it's moved from being a kind of 10-week programme towards being a 20-week programme. And so typically projects now last around 20 weeks. And this is dependent on the funding that Manchester Camerata are able to secure in order to deliver this work. So it's been funded by a range of different funders, including some NHS integrated care boards, but also local authorities and charitable trusts. If we can move on to the next slide, please. So what's Music in Mind training and how does it differ from Music in Mind as it began and how it's transformed over the years? So especially during the pandemic, this work kind of took off because there was really seen that although we had these kind of sessions every week, that people with dementia could engage with these professional freelance musicians and music therapists, there wanted to be more opportunities to be able to embed this work in the more day-to-day lives of people with dementia, particularly those living in care homes. So the ideas came about for Music in Mind training, which was to really train social care staff and really upskill them in musical improvisation to be able to do this work with people with dementia in more everyday contexts. And so the kind of outcome of the training is really focused on social care staff being able to lead improvisation-based group music sessions for residents in care homes living with dementia. And it's a two-part intervention, and it brings together 20 of these kind of live face-to-face group music making sessions within care homes in Greater Manchester, which are co-facilitated by the musicians from Music in Mind and care staff. And this is supported us with 10 online reflective meetings, so every other week with the staff and the musicians who are delivering the sessions. And at the end of the programme, staff are given a certificate of completion, and Manchester Camerata provides instrumental resources and also kind of ongoing support after the training. Can I have the next slide, please? So I'm going to hand over to John now, who's going to talk you through the study that was funded by the NIHR SSCR.
Thank you, Robin. That was really, really helpful introduction. I think for myself, I think it's important to say that the School for Social Care Research was involved in Manchester for 5 years. It was funded between 2019 and 2024. And I must pay my respects to Catherine Robinson, who was the director of the School for Social Care Research in Manchester, and also to Angie at the London School of Economics, which was the national coordinating centre for the School for Social Care Research. Without their help and direction, it would have been difficult to have done this project. The work falls under social care research simply because care homes and care home staff are largely seen within the social care umbrella of an environment. So that's how we were able to apply for these monies. And I was one of 5 members of staff at the University of Manchester who held the grant for the School for Social Care Research in Manchester. It wasn't as simple as just saying because we held the grant we could get the money. We had to apply for it, and then it was nationally peer reviewed and decisions were taken at that time. It's also, as Robin mentioned, important to remember that this work largely started in 2021 when writing the first proposal, and that was at the time of COVID, or just the recovery to or from COVID. So just as Music in Mind training was developing, so was our thoughts about having to actually do the research work. How do you do that at the time of COVID? It's sometimes quite easy to forget just how challenging those environments were and have been. So our work was started back in 2021. It was funded from the 1st of June 2022, and it was initially for 18 months, but we were able to have around about 6 or 7 months of no-cost extension at the end of November of 2023, just to allow the study a little bit more time to focus on the data collection and the data analysis. And again, our great thanks to Greater Manchester for the support that they gave us at that time for allowing Henry to actually continue to work on the project. It was a partnership of, I think as we'll share in the next slide in a moment, the range of personnel who were involved. I was notionally the principal investigator. I mean, I've worked in dementia care since 1986, but in academia since probably about 1992. I've managed research grants, but I don't think this was about managing a research grant. This was about bringing together talents and allowing the postdoctoral researchers really to lead the project and lead our thinking. Without the postdocs, without Robin and Henry and the researchers on the project, there again would have been no project. They were central to the thinking and to the development of the findings which you'll now have. And I think for myself as a mental health nurse, it was largely my job to help facilitate and co-facilitate the processes which allowed the team to work together. And as I said at the very beginning, it was about working, within and between teams. So again, it was that interdisciplinary working and team working. And as I shared at the beginning, we worked with Manchester Camerata since the beginning of the Music in Mind, genesis really in 2012. We were there at the beginning and we're still there 12 years later. And I know it's moved now into a national centre and other parts of the university will take over some of the research work. But I think it's probably fair to say that a lot of our work has been on the creative social research methods side and exploring the in-the-moment work and also the ripple effects of music. Next slide, please. This is the slide that basically isn't very exciting, but it just outlines who actually took part in the project. For those who may not know what some of the acronyms mean, and I struggle with them myself, PI is principal investigator and COI is co-investigator. So where you see PI and COI, it's really the names of the people who were involved in actually winning the money to allow the research to happen. PDRA stands for Postdoctoral Research Associate, so basically Robin and Henry. And there were also 2 researchers who worked on the project over the 18 months that it was actually fully funded, and then through the extensions that we had. So as you can see, it was a very wide team that incorporated music, social work, nursing, improvisation studies, creativity. Creative Manchester are also involved. And Open Doors Research Group, who we will come back to a bit later in this presentation, but a really important addition to our team. Kathy Riley was a named co-investigator, and Kathy co-facilitated the Open Doors Research Group, who are a self-advocacy group of people living with dementia, who are based in Salford, and Kathy's based in the NHS. But it's a very dynamic team. We've worked with them since 2008 when we helped to set the group up. And again, without their support and direction, it would have been a very poor project. But a very dynamic group, a very important group. And I just want to pay tribute to Kathy and to the group members as we move along in this presentation. Next slide, please. When we came to actually write the research proposal to win the monies, we had 2 main research aims, basically. The first one was to go back to our roots and to look at the in-the-moment working. So what was happening in that moment during Music in Mind training? And because our focus was largely on everyday care practices of care staff. That was a key motivator for our work. It's very unusual for us not to involve people with dementia in our research, but on this project we just didn't have the time, which was most unfortunate. It was an 18-month initial project, and I think in our experience, to gain ethics permission to actually involve people with dementia would have taken us the best part of a year, especially people without capacity. So it was actually written into the proposal that we would not involve people with dementia, but we just want to highlight that and spotlight that ourselves. It's not something we would usually do. It was simply the length of the project. And the second one was to produce a theory of change. And we explained that a little bit like looking at a roadmap. Henry and Robin again took the lead in developing our theory of change model, as will be shared during this presentation. But if you think about a theory of change as interactions in a roadmap, what makes things work and how do they work together? And basically from that sort of theory of change model, we can start to potentially scale up the intervention. If you think about music in mind training as a social intervention, you can start to scale that up or see how it could work in other contexts. And with that, I'd like to hand over back to Robin, please.
Thanks, John. And can we have the next slide, please? So I'm just going to talk through the methods that we used and how that kind of led to this theory of change model that has been developed as a result of this project. So the study was underpinned by a process evaluation to build this theory of change of how the music in mind training worked and how it led to different impacts that we observed. So we're really focusing in on the kind of process rather than necessarily just measuring any specific outcomes. And for those of you who aren't familiar with process evaluation, it's an assessment of an ongoing program or project to determine whether it's being implemented as intended. And it really focuses on procedures, activities, and operations to ensure that they align with these planned objectives, but also identifying areas for improvement. And this is something that is always a pleasure to work with Manchester Camerata on, because they're an organisation who really take a critical approach to their work. So they're always looking to develop the evidence around it, but are also aware of the challenges that are facing the implementation of programmes like this. So in order to do this, we used a range of methods to collect different types of data which fed into the process evaluation and the associated theory of change model. So we may talk about this a bit later if there are any questions about it, but recruitment was a bit of a challenge within the context of this project. And so we had 2 staff carers who were our kind of our participants within the study. And then we also recruited 4 musicians and music therapists who were delivering the music in mind work. And then we also did some oral history interviews with people who'd been involved in music in mind over the 10, 11 years that it's been operating, so that we could kind of get a sense of how these ideas have been changing over time and how the training program had come about. What was the kind of inspiration for it? How had the thinking changed over time? In terms of the music in mind training itself, we did observations of 18 online training sessions, which included the musicians, music therapists, and staff carers who were taking part. And they were also, we complemented this with some interviews with the staff carers and the musicians and music therapists to kind of unpick their experiences of the training programme. And in terms of the analysis, and if anyone's interested, I'm sure Henry can talk to you more about the different approaches we're using, but we kind of combined reflexive thematic analysis and narrative inquiry so that the theory of change model was really based around the stories that were told by the care staff and the musicians and music therapists, so that it was kind of from their perspective as well as from an organisational perspective. And then we collectively worked with the co-Is within the team, but also with Open Doors to develop 4 versions of the theory of change model. which I think now's a good time to hand over to Henry, who will talk you through the kind of findings from the theory of change development and these different approaches we're taking in presenting them to different audiences.
Lovely. Thank you very much, Robin. Could I have the next slide, please? So I apologize that there's a black line through the word excerpt at the top of this. That's my PowerPoint skills not quite working. So when we were putting together the theory of change across the team, we had a strong sense that it was important to ensure that our findings were translatable, shareable, made accessible to a variety of different audiences. The stakeholders involved in this research include people living with dementia, their families, family carers, staff carers, academics, musicians, organizational employees, lots of different people, partners within the university and outside. And so as we were developing the theory of change models, we came to the idea of creating several different streamlined versions of the models. The excerpts, which I'm going to talk you through in this presentation, come from our largest complex theory of change model, which is also the subject of our primary output paper, which is currently under review. We created 4 versions: a complex model, a more streamlined model, a simplified model, and then a postcard model. And the postcard size model in particular was shaped and directed in conversation with the Open Doors group. There is a link to download the postcard copy of the theory of change model, which you can find, I believe, in the chat. And that is a version which we hope explains what it was that we were doing, and also the findings that we've come to in clear and transparent language. As I say, this was fed into significantly by Open Doors, and I'm very grateful for their support in making sure that the way we put things forward was accessible and meaningful. In this presentation, I'm going to focus on some arenas of the theory of change model as I talk through the findings. I'm not going to present the model in its entirety. What I want to focus on really are the mechanisms for change which sit at the center of our model. When I say mechanisms of change, I'm really talking about what makes this program work, what sits at the center of the program, what is needed, what is required in order for it to function in the way that we expect it to, and what kind of levels are these structures at. So in this diagram, you can see on the slide here, we have 2 arenas of these mechanisms, 2 arenas of these gates that make things work or not. We have the individual and interpersonal, and we also have the structural. Individual and interpersonal mechanisms really revolve around the relationship between the staff carers who were taking part in the training and the musicians and music therapists who were delivering the training. And these relationships absolutely sit at the core of this training program. They sit at the core of any pedagogy, really, if we think about teaching relationships, guiding relationships, mentoring relationships. But we were particularly interested in our team at looking at how these relationships shaped the training as it moved forward. If I can highlight the 4 arenas of mechanisms that you can see in the excerpt here, the primary things that we came away with were that collaboration, shared values, mutual respect and validation, and openness and reflection sat at the center of this training program. And I'll just speak to these briefly as I move through. So the staff and the trainers shared their experience of delivery, of doing group sessions with residents living with dementia in the homes, and they also shared the experience of reflecting on those sessions. So the musicians and the staff carers coming together in the room to work with residents living with dementia, to implement, to realize the sort of wider training was really important. The musicians, music therapists, and the care staff combined disciplinary expertise when they were delivering these sessions and also when they were reflecting. So it wasn't just a question of musicians and music therapists coming into an environment and delivering a set of instructions or a way of doing things and handing that over. The social care staff brought their expertise and they came together in the reflective sessions, and it was critical for both of these arenas of expertise to be together. When I talk a little bit later about improvisation, we can think about how there's actually a huge amount of overlap between the skills that the musicians were actualizing musically and the skills the social care staff brought in from a social and interpersonal perspective. The trainers equipped the staff with new skills. This was the point of the training. It was really important. And that was based on this mutual respect and validation. So relationships of trust had to be built between the trainers, the musicians, and the staff across the 20-week period. Staff also discussed their experience with their peers and with management. And so they were able to share how they were experiencing the program and share their thoughts on what they were doing in reflective sessions and in group work. The staff expressed that they felt seen and that they were listened to, that their experience as their professionals had been validated through taking part in the training. This was also contingent on the staff carers, and the musicians being open to sharing and open to learning new skills, open to change in practice and routine, particularly on the part of the staff carers, and reflecting and adapting what they were doing in the moment based on what they'd learned. I'd like to highlight as well that a core motivator for the staff taking part in this training was the perceived benefit for the residents living with dementia who were in their care. The belief that the residents living with dementia were creative and engaged and enjoying the sessions that they were taking part in, that the music that was being made was accessible and had meaning, and also a person-centered approach to care and delivery on the part of the social care staff, but also on the part of the musicians. Much of the reflective aspect of this training involved discussing different residents, building profiles of their likes and dislikes, focusing in on very almost sort of intimate ways that they might interact with an instrument in a tactile way, honing in on the individual and ensuring that they were catered for musically and socially within the group context. Without wanting to gloss over the structural mechanisms, it was essential that there was effective operational management for this training program. It was a complex intervention with a lot of moving parts. It involved instruments, it involved people, it involved the resources of space and time and people coming together, ensuring that musicians, music therapists and staff could get together to reflect all together at the same time, making sure that there was access to Zoom for online reflective meetings, making sure there was a link to the training resources and that these were utilised effectively. So on the part of the care home and also on the part of Manchester Camerata, as what we're referring to as the training organisation, it was essential that there was smooth running of this process, maintaining resources, providing support to the trainers, and also effectively coordinating all the complex moving parts was essential for the running of this program. Could I have the next slide, please? So as we were evaluating this, we were looking for the things, as Robin had said earlier, the things that were being implemented as was expected, but we also were looking from a narrative perspective at our data to try and understand what the ideal conditions might be for this kind of work. All of the items that you can see here in this excerpt from the model refer to what we think would be the most appropriate ideal conditions for a program like this to take part in. I should say that, like everything in our model, this is in one sense propositional. And so if we were to project forward into further implementation of this program in a different space or in a different context, there would be different kinds of contingencies. This is based on the data that we have and that we've gathered and our analysis. If I could just highlight a couple of things here, dedicated personnel employed to coordinate between the trainers and the care home staff and act as a point of contact during training, transitions and legacy was essential for this work. So having, in this case, someone who is based with Manchester Camerata to coordinate between the trainers and between the musicians and music therapists who were freelance, as well as with the care homes, was really essential. In terms of the style of delivery within the training, the content had to be engaging, empathetic, and critically accessible to non-specialists. So what we observed was that the musicians and music therapists variously tailored their language and changed the way that they were approaching things to suit the needs of the care staff who were taking part in the training, and ensuring that things were explained, particularly when where an amount of musical terminology might be a little bit obscure or might not be immediately accessible to people who have not taken part in extensive musical experiences before. Also of importance are the fact that this intervention lasted over a period of time, which allowed the staff carers to participate. Comments from the staff carers also indicated that this allowed the residents to develop a sense of routine. So the residents who were taking part in the music sessions as well, according to the staff carers, benefit from the fact that the delivery of this program was over a longer period of time, that it was consistent and that it was regular. But also something critical was flexibility within the structure of this delivery. So the staff and the musicians being able to accommodate changes in schedule, as well as fitting this around other aspects of their work, was really important. Something which was came through strongly in the interviews was the question of how to transition in and out of a program like this, what was needed, what kind of support, aftercare, and legacy work would be beneficial. And from the perspective of the musicians and also from the staff carers, the idea of a softer transition out of the program that enabled some form of legacy work or sustained contact was seen as something that would be beneficial to this work. Could I have the next slide, please? I'd like just to talk through some of our projected outcome and impact pathways for this work before going on to talk a little bit about improvisation. So based on the data that we have and based on our analysis, we looked at some of the ways that we think that this might have impact in the future. I'd like to draw attention to the box that is at the bottom of this excerpt, which is a little feedback loop describing how the staff becoming equipped with the ability to recognize resident engagement through music making led to an overall sense of improvement in their well-being, but also an increased capacity for them to do their work. Through doing the musical training and through learning how to facilitate improvised group music making, the staff became more able to see when residents were engaging with instruments and see how they were interacting in the group. Staff's perception of there being positive impact for residents led to an increased morale, an increased sense of well-being, and an increased motivation for the staff to deliver this work, and also to take aspects of this into their wider care practice. We have suggested that a training program like this, in this instance, could then lead to staff being able to deliver a better standard of care for the residents, and also this having a knock-on impact of improving holistically quality of life. Recognizing the improvement also can increase morale. And so through really honing in on the way that residents engaged within the music making sessions and understanding engagement and enjoyment, the staff were able to better facilitate this kind of work. We have noted in the interviews in particular coming out of this, which were done towards the end of the training, that there was practice change indicated by both staff members who took part in this. So one of the staff members had started to implement music in mind methods within their wider work within the care home, taking instruments into, for example, exercise classes, not just doing things in groups, but also going and working on a one-to-one. And the other staff carer also indicated that there had been a change in their practice through trying to facilitate different group sessions, thinking about purchasing instruments for future work, finding ways to bring other staff into the process and have wider engagement across the home. So taking part in this training leads then, or could lead then, to an embedding of this work within the care home context and to wider practice change. This would be contingent, of course, on the context of the home in which this took part and also on resources and the other gamut of variables that we've presented in the model. But from what we can see from our data, there has been, at this point, some practice change with the staff who took part in the training. Could I see the next slide, please? I wanted to talk a little bit about what improvisation is within this training context and within Music in Mind. Because it's unusual to have an improvisation-based music training program. Improvisation has a strong presence within music therapy and music therapy adjacent work. And it sat at the core of this training program the way that the residents interacted with each other musically in Music in Mind sessions, and also the way that the staff were encouraged to work with them, was improvisational. So it was spontaneous, it was generative, and it was reflexive. It was very much contingent on who was in the room, working with them in the moment, and meeting them as they are. And that was a really important emphasis within this training program, which I would suggest is fundamentally inclusive. It allows people to exist within a space, and it allows their contributions to be held as equally valid within social music making. Improvising within the Music in Mind context as well, the staff and the residents were moving with different flows of memory, different kinds of interruptions, interjections, sometimes speech, sometimes different forms of other musical contributions. And again, within an improvising space, all of these can be held together. There was an emphasis from the musicians within the training that all different kinds of contributions from residents in the space had the capacity to build the music together and to have a sense of cohesiveness, even if sort of on their own, it might not feel that way. Improvisation within Music in Mind also, on that basis, encouraged many different levels of participation, including peripheral. So even if people within the room were maybe sitting towards the side or not interacting with an instrument in a way that you might expect, for example, hitting or tapping, they were still involved in the process. And again, this is something which the musicians emphasized strongly for the staff who were taking part in this training. Concentrating in the moment as well on who is in the room, the resources to hand, and what's happening, represents a slightly unusual activity within the dementia context. Working in this way is not focused on, for example, reminiscence or memory, nor is it overly forward-thinking and projecting into the future. It's really revolving around what's happening now. And that was a critical focus as well within this training, to make sure that the staff were bringing attention to the moment, to the interactions within the moment, social and musical. Spotlighting individual contributions was also essential within the Music in Mind delivery, and this also forms a part of wider group improvised music making, allowing people to come in and take a solo, allowing people to step back and support, allowing people to be quiet if they want to, and to participate in a way which is meaningful and appropriate for them. This space of improvising also can legitimize the presence of both, and I put these in quotes, positive and negative emotional expressions. So no one is expected necessarily to be doing something which is quote unquote happy all the time. The different ways that people can express themselves on instruments, the different kinds of tactility, and the different forms of musical expression which might come up can all be held together in an inclusive manner. And again, this was really kind of the emphasis of the training, or of one aspect of the training moving through this. This kind of work represents person-centered practice in both a musical and a social sense. So being able to focus in on the way that different residents were bringing things into the musical space was also reliant on the expertise of the staff carers, knowing individuals, being able to tell their likes and dislikes, seeing how they were interacting. Can I move on to the next slide, please? So just to flag some arenas of recommendation which were made to Manchester Camerata on the basis of this work before we move on to talk about open doors. Sustained relationships between the staff carers and the musicians was really important in this training, as I've already said. And so finding ways to sustain that moving forward was of importance. Making clear the expectations on the staff who were coming into the training was something which was also flagged as being important. Facilitating music making is a very complex thing, and it requires a lot of different skills. And so being clear on what skills were going to be worked on, what skills were going to be worked with through the course of the training is something which needs to be a focus for this kind of work moving forward. Maintaining suitable and accessible resources, which also were not using overly complex terminology, was something which is important for this kind of training to work, on the basis that we're bringing in people who may not necessarily have musical experience to learn how to do what is actually quite complex musical activity. And then, as I've already mentioned, program structure, consistency, and flexibility, ensuring that the delivery pattern gave maximum benefit for the work that was able to happen, through making sure that it was consistent, making sure it was across an extended period of time, but also allowing flexibility within that structure to accommodate the changing needs of staff trainers who were taking part. Next slide, please. Okay, we're now going to move on to talk about the Open Doors group. And forgive me, I've forgotten which one of us was going to speak to this immediately. Robin,
I think I was going to start off and then hand over to you, Henry.
Wonderful. Okay, thanks very much, Robin.
Yeah, no problem. So as we mentioned throughout the study, we worked with Open Doors Research Group to understand how they felt training programs like this should be delivered, and how people with dementia might gain further opportunities to engage with music within care homes. So we worked with a group of 14 people with dementia and family carers, and it was really clear from the outset of this PPIE work how strongly the group believed in how music can be used to support people with dementia to especially feel a sense of hope during their dementia journey. And they also individually highlighted how significant music had been within their lives, and how many kind of memories in particular were connected to different pieces of music, which helped them to share parts of themselves with the group. And what came out quite early in the process was that the group wanted to create something that was quite tangible, that could be used as a discussion piece for people with dementia, family carers, and staff carers to talk about music more widely. And I'm going to hand over to Henry to talk about how we brought these ideas to life with the group.
Thanks, Robin. Could we see the next slide, please? So we worked with the Open Doors group in discussion to really understand their experiences of the importance of music, and what music meant to them in terms of moments through their lives and how they felt music was important for people living with dementia and an important marker of experience. We were very fortunate to work with a studio called Jane Bauer, who is a Manchester-based designer and artist in this process. And so Jane and the research team and Open Doors came together to have discussions around the importance of music, and to co-design this wonderful vinyl record sleeve, which you can see in the slide here. This was a process of consultation, of reflection, of making sure that people's voices were represented. And Jane and the group worked together to design this, I think we called them like bookmarks for individual stories. So all of the different images that you can see in this vinyl record sleeve represent a different story and a different relationship to music brought by somebody in the group. Through this process as well, we also discussed the ongoing work we were doing with the training program, and the group asked questions around the approaches of the care staff and also the approaches of the musicians within the training program. When we were coming to propose and present the theory of change models, as I mentioned earlier, the group fed in with critical questions and shaped the accessibility of the language within that model. They also gave some wonderful descriptions of these memories that they brought, which are represented in this sleeve, and had a lot of really vibrant conversations about color too, about the different kinds of color that would be used in the record. This record sleeve is shortly to be on display within the Woodlands Hospital. Is that right, John? That's correct. And Kathy Riley, who co-facilitated this group, who facilitated this group, has been fantastic in ensuring that this is going to have somewhere where it can be seen, and where this work can be talked about within that context. I'm just going to pass to John, ask if John, you'd like to say anything more about the way that we work together with Open Doors.
Yes, well, the work took place in the Humphrey Booth Resource Centre, which is a lovely environment in Swinton. And people with dementia from the Open Doors Research Group were familiar with that environment. We worked in that environment for a number of years. And I think having access to the environment helped an awful lot. And we also introduced people with dementia to a Music in Mind session from the Open Doors Research Group at the very beginning, just so they could get a feel of what it was to take part in an improvised music making group. It was for myself probably one of the most exciting projects I've ever worked in, and it was a really lovely opportunity, I think, to bring together the creativity of people with dementia. Because originally, when we wrote the research proposal, it was going to be a magazine, or a zine, as we called it in the proposal. But people with dementia said, no thanks very much. Let's do something else, which is more meaningful in terms of a biographical, my own identity. I'm rapidly turning in to be 64 years old, and I remember buying LP records in the early 70s, and I think it was that sort of connection to space and time and place, and the meanings and the physicality of holding a record that people with dementia really connected to in the group. And for those of us who may be old enough to remember buying Pink Floyd's album Wish You Were Here in 1975, which is worth quite a lot of money these days, but the original copies came with a free postcode or two, as a way of linking the material object to the music on the record, and an interaction between a purchaser and really something that you can take away from the object that you could have as yours. And in some ways that influenced our decision and our decision making of the group, really, to say, well, what else? Because yes, the record went into a record sleeve, but so did sometimes some free things like posters and postcards. So those things were started to link up the project, both from the creative aspect of people with dementia, but also to the practical outcome of our research, and also for the theory of change model, which we'll address in a moment in terms of the postcard. Thank you, Henry.
Could we move to the next slide, please? So I just wanted to highlight that the color scheme that was created by the group is also then the color palette which we took forward for the theory of change model. So this model is available, and I think a link has already been put in the chat, and we can circulate something afterwards. But this is the version of our full theory of change model, which was created in collaboration with Open Doors. Just to highlight some of the different sections, we framed these in what we believe and what we have been advised through speaking with Open Doors is accessible language. What is it that we were researching? What is music and mind training? What is needed for this training to happen? What makes it work? What can it do? And this is our sort of summary of the complex model, which has been distilled now down into these different arenas. So all of the same things that are in the different versions of the model can be found in here. The questions from the Open Doors group when we were working through this were really valuable in trying to understand particularly how we within the academic context can make sure that our work is meaningful, visible, and accessible to those who don't necessarily have access to the same networks, resources, or spaces which we do. And we're really happy that we were able to produce this together with Open Doors. Could we have the next slide? So we're moving into future plans and questions, and I'll invite John and Robin to contribute to this as well. But we have just come to the end of this study, and we've recently finished all the processes that come with the end of a research project. Our primary paper has now gone through and is currently under review. And we are also awaiting a date when the final sleeve will be available to view at the Woodlands Hospital. I might hand over to Robin just to talk about kind of future plans around this work, and John as well, if you wanted to contribute to this too.
Yeah, just one, especially the kind of PPIE work. I think it's been one of the kind of highlights of this particular pocket of work that we've done. And so we are hoping to be able to write up some of our reflections on that kind of co-creative process that we had as part of the PPIE work. So that's another kind of watch this space item. John, do you have anything?
Nothing of great significance, only to say that it has been and continues to be a really meaningful project. And I think both the theory of change model and how it came across and how it was developed, and the working alongside people with dementia. There was always even though it wasn't part of the people with dementia as part of the original research design in terms of an interview, I think we always felt people with dementia were involved throughout the entirety of the project. And that for me, and I think for the research team, was incredibly important. And just like Robin, I'm very excited about the way that music could go forward in the future, not simply within the theory of change model, but also within music and records and vinyl and other ways that people with dementia can connect, because we're just human beings. We connect to our lives through music and through memories and through the materiality of what we see and what we touch and what we sense. And I think that is, again, a very important future direction for this work, to continue to tie up those two frames together. Thank you.
So maybe we can now open the floor to any questions that there might be. You can see that the Creative Manchester team are just popping some instructions and information into the chat about how you can ask questions. Just to say that for people who are deaf or who would like to ask a question in their preferred language using BSL, please let us know, and the events team can turn on your camera so that you can ask your question. So we have a question. Oh, here we go. More questions are coming in. So, so we have a question which I'll read out, which someone has asked on the Padlet. First of all, they are asking. They said they've noticed that there's a bit of a turnover in the care workers in the care home where their father was living, and many moved on after a few months. They've asked, was that an issue in our experience within this project?
I think the main challenge, that was a challenge when it came to recruiting care home staff. For certain, there were a lot of restructures that were happening within different care homes that we were approaching, which just meant that the offer from Camerata just wasn't feasible at that time. And that's a real challenge when you have a research timeline to be able to collect data. So yes, it was a challenge, staff turnover, and in the future, obviously working with one carer in each home is not an ideal situation, because if that person leaves, they take that knowledge with them. So it's not the not the ideal situation. But those who did take part were incredibly committed individuals who really gave everything to this, the training and the research process.
Just to build on that, just for 2 seconds, we also had to lower our threshold of care homes. Originally, we wanted 3 care homes to take part, but we ended up with 2. And I think that's probably may have been a legacy of COVID or the time that this work was done. But I think, undertaking research work in care homes takes time. And I think as a reflection from the research team, we probably could have done with more than 18 months, and a 2-year study probably would have been a minimum going forward. It puts a little bit too much pressure on everybody. So just as a learning point from a research design point of view, I would say that a 2-year study within a care home is involving care homes is sort of essential, to be honest with you. It was the talents of the team that enabled us to complete the research. But I think going forward, care homes are special places, and a lot of very special people work there, and we need to accommodate their timelines and not ours.
Just picking up on a couple of related questions that I can see coming in the Q&A, and forgive me, I'm jumping around these. There's a question here about how long after the end of the project did we monitor the carers' continuation of their work, and sort of whether it was embedded. When we did the final interviews with the staff carers, that came about 2 weeks after the end of their last reflective session. So it was not long, basically, after the end of the sort of formal period of training, I suppose, that we spoke to them about the ways that they were thinking of taking things forward. Within this study, we were not looking sort of longitudinally at the way this is moving going forward. And this is one of the things which is an arena for further research. It's essential, actually, to be honest, in terms of how we understand whether our model, which we've proposed, is viable in terms of the sort of impact pathways that we put together, and how this work might exist longer term in different spaces. Something to flag, I think, is that the staff carers had this improved sense of well-being and morale through taking part in the training, but that dipped slightly towards the end because there was concern around how this might be implemented in a solo delivery capacity without the musicians. So this was a question which formed part of our recommendations to Manchester Camerata, and also is a question which we've raised in our paper, which is under review at the moment, around how this kind of work moves forward and what support is needed for carers to be able to embed things within their future practice. I'm relating this to a question that I've seen come in here from Ailish Mackenzie, asking, do you think this program would work or be useful for personal carers, i.e. family members, thinking that some families would be interested in having an informal music session at home? And I'd just like to flag that it was our intention earlier on in the study to recruit family carers, also sometimes called informal carers, into this study. We faced barriers to recruitment for family carers with this study. Accessing family carers through the care home environment, their attendance is much more sporadic than people who are there working in a remunerated capacity. And so just unfortunately, we were unable to recruit family carers into this. The training that we were looking at was open to family carers being able to take part in it. So although we ended up looking at the social care staff, it was geared to be open, something which informal or family carers could also take part in. Robin and John, can you also see these questions, just out of interest?
Yeah, do you want me to take that on a couple of questions? That's fine. Yeah. So we have a question about, well, there's one that I can answer very quickly. So there's a question about what's on the vinyl. So the vinyl record itself is just a dummy vinyl. We hope that in the future we could do some work with people with dementia to create some music that could be on a vinyl record. But within the context of this, the focus was on the artwork of the record sleeve rather than the music that would potentially be on a record. There's also a question about whether this the model could be used more widely in care homes nationwide. I think there is a real potential to test this model in different contexts. I think there are a lot of things that are very specific to music in mind training, but there's also a lot of elements of the theory of change model that are that could be generalized to different contexts. And I think that's really exciting, especially those kind of areas of mutual respect. And also the kind of bringing together of different very experienced people to create these outcomes we're seeing with people with dementia. We're drawing near to the end. There's 2 more questions. Do you think we can do a speed round? Yeah. Okay. So we've got one question which is about whether Open Doors commented on the differences between improvised music making and their other lived experiences of music. I think I was in that session. I don't think you were in that session. So I think in terms of the improvised music making, I think it was very clear to see how people could create something together. And there was a lot of fun and joy and laughter in the room as that was happening. I think because of the nature of the vinyl records that we were doing, the groups became more centered on this kind of biographical approach to how music had accompanied someone through their life story, just because of the nature of handling things that were from the past. But I think it's an interesting distinction because we're, as a research team, making a very clear distinction between improvised music making and perhaps this more reminiscence-focused approach. So that's something we could maybe explore further in the future. And then the last question is about whether any of the care homes wanted to take on their own music therapists as a result of the training, and whether this could be extended into other social care settings like learning disability day centres or residential care homes or mental health settings. So I'll let you take that one, Henry, if that's okay.
Sure. I mean, I think that it's just gone. Sorry, let me just get the question back up so I can see. There it is. So in terms of the care homes that we were working with, did they want to take on their own music therapists as a result of this? It's not something that not data that we have access to. They didn't express that they wanted to bring on a music therapist explicitly. However, the staff who we interviewed at the care home who took part in this training were incredibly enthusiastic about taking on this kind of work. They also really emphasized the importance of working with professional musicians and music therapists within the training. So having access to highly skilled musical professionals who were coming into their environment to do the work was really important to them. And in that sense, they talked about how wonderful it would have been if it could continue, and how it would have been, how that could have been a great thing to happen. So there was definitely an appetite for that. Music therapists more widely do work in a huge variety of different contexts in different care homes, as well as across other social contexts, including the ones that you mentioned here, Rachel, in this question, disability day centres and mental health settings. In terms of is this work that we've been doing extending into these different settings, in the end of the model, we talk about how this, we think that the aspects of this model, as Robin has said, could be applied in different contexts and could be tested in different contexts to see how that would function. More widely, Manchester Camerata's sort of music in mind work, as we said earlier, has existed in several different spaces, and looking forward to the developments which come through the new centre with Manchester Camerata, we can see how maybe this might move into different arenas. In terms of our research plan, we're not explicitly looking at this at the moment, but it's definitely something that we could think about in terms of what aspects of the model might transfer where, what would be different, who would be different, and what the contextuality of it would be, I think is really important. Yeah. Manchester Camerata's wider community work also is something to look at in relation to this. So on the Manchester Camerata website, which I'm sure we can circulate, and it might be in the event information, there's lots of stuff around the different diverse forms of community work that they do. So there's other stuff happening as well. Apologies, that feels really vague, but I hope that was okay. Okay. Are we coming to the end? Lovely. So thank you, Great Majesty. Perfect. Could we have the very last slide, please? Thank you so much, everybody, for attending. And I'd like to just extend my thanks to John and Robin as well, and to Russ for being here to interpret for us, and to the Creative Manchester team who have worked tirelessly behind the scenes as well to set up this webinar, ensure that everything runs smoothly, put all the comms information online, and make sure that this has been accessible for everyone. So my thanks go to everyone. And thank you all also for attending and for coming along. You can see contact details on this slide for myself, for Robin, and for John for further questions, or if you'd like to get in touch around the work. And as we've already flagged, there are several kind of watch this space arenas around the upcoming paper, and also around Manchester Camerata's wider work also. A recording of this webinar will be captioned and made available as well via Creative Manchester, and information about that can be circulated as well in due course. unless there's anything else to say, John and Robin, maybe we can just say thank you very much, everyone, and thank you for coming.
Thanks, everyone.
Thanks, everyone. Thank you.